Hey all, so this week on the channel we have Dr. Zach Thomas with us. He is an orthopedic physical therapy resident at Stanford Healthcare Orthopedics and Sport Medicine Physical Therapy Residency out in Stanford in California. And kind of talking to him a little bit about why he got into PT, why he chose to go into a residency, how he chose the program that he did, and then a little bit of reflection on his experience in the program so far. So Zach and I went to high school together. We became friends in 8th grade. He moved into our school district, and we've kind of been good friends ever since. So we went to high school together, played sports together, played football and basketball and stuff like that together. We were going over to each other's houses and playing sports in the yard. We both ended up kind of getting into PT through the same physical therapy clinic in town with Dr. Brian Hathaway at Peak Performance. So thanks again to him. And then we both decided to go to Ithaca College together, where we continue to be friends, and we actually ended up living together our last year there, and kind of have both decided to go into residency around the same time, and kind of are on this whole journey together. So I thought it'd be cool if we talked to him a little bit about his experience, and then each month we're going to try and each catch up and reflect a little bit together, so we can kind of give another perspective and some more people to hear from, and try and give more resources for y'all to be able to look to if you're considering residency or if you're a PT student or things like that. So I'm going to change it over to the Zoom with Zach, and I'll put his contact info down below in the comments. And thanks for watching. If you have any questions, feel free to reach out. Alrighty, hey y'all. So Dr. Rips Rehab here with Dr. Zach Thomas. He went to physical therapy school with me. We actually went to high school together. We met in 8th grade, and we've been good friends ever since. So brought Zach on because he is doing an orthopedic residency out in California. And I thought it'd be a good idea to kind of get some different perspectives from somebody else who's just starting to go into a residency program. And then we're going to try and kind of catch up once a month on a video to kind of bring you guys some more content, just to give you more perspectives from current residents and somebody who's in a different field. He's in the orthopedic field, I'm in the neurologic field, and try and share some more information and provide you guys with some more resources. So I'll give it away to Zach to introduce himself and kind of just describe how he got into physical therapy.
How's it going, everyone? So like Rip said, I went to high school with him, and then we went to physical therapy school, both at Ithaca. Spent 6 years there. Great time there. Since then, kind of bred my interest for orthopedics, and which led me out here to California now. So I'm trying to bring some of that California sun to you now, because it's 90 degrees here. So as far as just what got me into physical therapy, I was fortunate kind of early on. I had a lot of just experience in being exposed to the field from like middle school on, with a therapist back home that I did a lot of shadowing with him, and kind of got to get a lot of hands-on firsthand perspective, which just helped grow my interest. And even before then, I just had a very strong passion for health and wellness. And I wanted to get into a field that allowed me to, one, expand my knowledge on that, and then two, also offer the knowledge that I had to others, especially in instances like in the rehab setting, where they're trying to come back from, whether it's just some nagging injury or they just had ACL surgery and they're trying to return to the sport. So whatever situation may be, that's what kind of led me to PT, was just my desire to help others, a field that allows me to continually expand my own learning, because there's always something new research article to read. So I really enjoyed that challenging aspect of it as well, that it's not a job that you can just kind of settle in. So I guess that's a long-winded answer of what got me into PT, but that's why I'm here today.
So yeah, Zach and I both have Dr. Brian Hathaway to thank for helping get us into PT school and letting us shadow him and kind of learn from him. And we both went to the same college and ended up kind of going different routes from there. But as Zach mentioned, he's in beautiful sunny California. I'm in Washington, D.C., where it's dark, and it was a nice day today, but it's certainly not in the 90s. So yeah, thanks for sharing that, Zach, and hopefully that can give a little bit of your background. And then, so I guess the first question is, why did you decide to go into a residency program?
Yeah, I think that's a great question, and a question that probably a lot of younger PT students right now are trying to decide if that's a route they want to go. And I think one of the biggest reasons for me deciding to go into a residency was partly just that continued education aspect of it. As much as I feel weird to say, it's like I didn't want to leave school yet. So I wanted to continue that, being in that learning environment, more so than just going to another clinic, because there's definitely a lot to learn in that setting as well. But this is just a little bit more of like a structured way to do that, and a way to kind of allow me to specialize in orthopedics, being the musculoskeletal system, which I really enjoy doing. So just to kind of further my expertise and learn from experts in the field in that area to try and better myself in the future. And then I think one of the other biggest components for me is the mentorship aspect of it. So currently at my residency now, I have at least 6 hours a week of set mentor time. And I'll also have like 7 different mentors throughout my time here throughout the year, which to me was super important because I'm very much learn by example. I like to watch others and then take bits and pieces from them to ultimately build the therapist that I want to be, and then allowing them to provide feedback on where I'm at and then being able to grow from that. So I think that mentorship component was huge for me as far as why I got into residency.
Yeah, thanks for that. And I've already kind of made a video describing why I got into residency, and it was kind of along the same lines as Zach just shared. Maybe it's something in the water down in Owego that makes us kind of similar in that perspective. But thanks for sharing that perspective on kind of why you decided to do a residency. I think that kind of helps others who are maybe considering residency or trying to figure out what they want to do after school. Gives them a little bit of perspective to think about why they may or may not want to go into a residency program. And I think one thing that's important too is to talk to your faculty members and talk to your professors who know how you learn, and just ask them. I know I did. Like, do you think you would? Do you think I would be fit in within a residency program and kind of like the style of a program? Because they're going to know based on what they've seen how you learn and how you respond to things like that. I don't know if there's anything you want to say to that, Zach, but.
Yeah, I was going to say I would second that. With just, I think definitely throughout my time of deciding which residency to do a residency, all that kind of stuff, I leaned on my professors a lot, ones that either have done residencies in the past and gotten their thoughts on it, whether they would do it again if they went back, which 9 times out of 10, the answer was always yes. They never regretted it. And just that it made them into the clinician that they really wanted to become. So definitely second the fact of talk to those people around you that are going either in that similar state of you that are trying to decide, or that have gone through the process, because you can definitely learn from others and take their advice for sure.
Yeah, and just to kind of make another quick comment off of that, Zach and I lived together our last year at PT school, and we were quite often talking to each other about the process and kind of discussing how we were going about it. And I think it helped me solidify my decision to go into a residency. And I don't want to speak for Zach, but I feel like it probably helped you too a little bit, just us being able to bounce ideas off each other and using each other as a resource to continue to try and help us make the best decision for ourselves.
Yeah, it was definitely nice to have someone going through the same process at the same time, kind of thing, and kind of jumping over the hurdles together to get to where we are now.
Yeah. All right, thanks, Zach, for kind of sharing why you decided to go into a residency program. So now we'll get into the other questions, and then we're going to kind of circle back to some of the things that you said earlier. So, why did you kind of decide to go into ortho, or what was the kind of pivotal moment where you decided you wanted to do ortho, or did you always decide that you thought that you had an interest in ortho, and just kind of explain how you got to that decision?
Yeah, for sure. So I was always, ever since I've gotten into PT, kind of that orthopedic sport realm, sport medicine has been my interest. And I would say that that just continued to grow throughout my different experiences and clinicals throughout school. And I was very in between sport and orthopedics, which there is a lot of overlap with those. And I guess why I ended up going more the ortho route is what I found, again, with talking with professors, and I even went to other professors in the AT program too to kind of get their perspective, is that the sports side of it was more of the on-field experience. That was like the biggest difference that I saw between a sport residency and an ortho residency was the sport residency required a certain amount of hours on field, whether that be working with like a high school team or college team somewhere in the area, um, which I think is interesting. But I didn't want to kind of just limit myself to more of the like AT side of things. I liked to be and prefer to be more on like the longer stage rehab side of things, not necessarily that on-field experience. So that's one of the reasons I would say I kind of went more ortho. And I also, as much as I love working with athletes, and I think I get along with athletes really well because I can relate to some of the things that they're going through. I also enjoy having that flexibility in your schedule of working with different age groups, different populations, and kind of just having that flair of not knowing what's coming next. So it kind of kept me on my toes a little bit more. And as much as I get along with athletes too, sometimes I really enjoy working with that weekend warrior or your grandparents that want to get back to doing whatever they need to do as well, kind of thing. So I wanted to maintain that flexibility of the patient population that I was going to see, but still be in the realm of that muscular skeletal physical therapy.
So you kind of always knew that you wanted to go into the orthopedic realm, kind of even before you entered school. You always had a feeling that that's where you kind of were going to end up.
Yeah, I always had a feeling that my dream job was always like the working with professional athletes kind of thing, which is still would be an awesome kind of thing and still something that eventually in the future I could do. But then there were some other things that just kind of led me a little bit more away from that and realizing that I could still work with a very similar population, be it like high level athletes, but not necessarily having the commitment of being part of a professional program where you basically have to devote your life to that kind of thing. So I thought that I could find a good balance of that in other facilities that I've been like in contact with or just done a lot of research on that would still give me the ability to kind of work with those higher level athletes, but also the flexibility of working with older patients as well.
Okay, great. So thanks for answering that question. I guess the next question we'll kind of get into is, could you just kind of talk us through your process for how you decided what program that you wanted to go into? Are you in the program that, was your top choice, and kind of how you narrowed it down? Because there's tons of different ortho programs throughout the country. And I know everybody kind of prioritizes different things. And what were the things that maybe you prioritized? Why did you prioritize those? And then what kind of led you to your ultimate decision to choose the program that you're in now?
Yeah, again, I think that's a great question. And like you said, there's a ton of orthopedic programs. So honestly, where I started was once I decided ortho, I went on the website that listed the directory of all the programs, and I literally clicked on every single link to every single website, um, and started there. And if their website jumped out to me, then I looked further. And if their website was like, this thing hasn't been updated in like 20 or 30 years, then I didn't necessarily just throw them away, but I kind of went off of that initially. Um, and then once I got a like list there, then I started to look. I made a spreadsheet with different things that I was looking for as far as start date, because I was trying to get one that started in August, and there's some that start in January or February. So the start date was one thing that was really important to me. The mentorship time, and also how many mentors, because some of them it's like you only have a couple throughout the year, versus the one I'm in now where I'll have at least 7 throughout the year. So that was another thing I looked for. The didactic component, which I looked one to see like where it came from, because some programs take their lectures from other programs and some create their own. So I wanted to go to a program that kind of developed their own didactic component. And then let's see, so I said the mentorship, the didactic, the location a little bit, but not so much. I wasn't using that as much of as a limiting factor. I was open to go wherever. And then opportunities in that setting as far as what there is to do around, meaning like the setting I'm in now, because it's part of Stanford Healthcare, which is like a big organization. I have the opportunity to sit in on different conferences with surgeons, or go down to radiology, or go to downstairs to pain psychology. And there's a lot of like the surgeons and the physicians are the floor below me. So that's one opportunity, that being in like a bigger organization, some of the opportunities that came along with that. And then I think lastly would be the teaching component. I really wanted a teaching component, which ironically where I ended up now, Stanford doesn't have a physical therapy program anymore. So the teaching component wasn't as relevant here, but I am hopefully going to be able to teach in the anatomy lab to the medical students. So I'll still be able to get a little bit of that. But that again is kind of where you got to weigh some of the pros and cons. So some of the other things really stuck out to me. Maybe there wasn't a teaching component in a PT program, but the mentorship was huge. So once I kind of got that spreadsheet made, then I started to really narrow things down. And as far as top choice goes, I only applied to 4, and I was down to 2 of them. And basically one of them, because of all the COVID craziness, they offered me a position, but then later on we're basically like, we can't guarantee you a spot because our clinic isn't sure they can commit to having the space or the capacity for another therapist. So basically they were like, unfortunately, we can't offer you the position. So that's part of what led me here, but I was between those 2 to begin with, and I'm certainly ecstatic with the decision that I made, that I'm here. So hopefully that answered all your questions.
Yeah, that was great. I think maybe it's just because came from the same background, or because we were living together when we were kind of going through the whole process. But I think we both kind of prioritized the opportunity that we were going to get through the residency program over everything else, and making sure that we applied to programs that we felt were going to give us the best opportunity, rather than prioritizing pay or prioritizing location or something like that. And I know some people like to prioritize location, and there's nothing wrong with that. It's just, it all depends on what you want. And I think that's an important point to make when you are considering residency. Is it's important to pick a program that's going to work for you and what you want to get out of it, and not just do things based on what other people do or what people tell you that they did. And if you really want to be in a certain part of the country, well, then make location part of your selection criteria. If you really want to teach, then make teaching, your number two prioritized or your number one prioritized thing. There's so many different programs out there, and there's so many different opportunities that each program offers. And, they're accredited, so they're good programs, and they
Mm-hmm.
get you the education that you need. But prioritizing what's important to you is going to make your experience better, and it's going to give you the best experience that you can get. And I kind of talked about how I chose this residency, and I was able to find one that kind of fit all of the criteria that I was looking for, and I'm very happy with it. And it sounds like Zach's pretty happy with the one that he's at now, and we're both still just getting started with it, so there's a lot to come. But I think it's important just making it your choice, and not a choice that anybody else can make, or following anybody else's criteria. Figure out what you want, and then use that and kind of go forward. I don't know if you want to comment on that, Zach, but.
No, it was excellent and spot on. I would say definitely there's, like you said, there's so many programs out there. They're all going to have their similarities, but also have their differences, which you might have to dig a little deeper to see that. But ultimately, I think one of the best advice that I actually got from one of the programs that I applied to when I contacted them was, he told me that we interview them as much as they interview us. Mm-hmm. So it's you looking for what's the right fit for you as well. So don't hesitate to, if their website's uncleared, reach out to them and get on the phone with their director and talk to them. Because that not only shows your commitment and desire to be involved, but also that you have further questions.
Yeah, and to second that, I think we both did a good job of reaching out to all the programs that we were interested in. I know we both kind of called their directors or sent them an email or both to figure some things out that maybe their website wasn't clear on. And I know there was definitely a couple places that I was like, man, this place looks like the bee's knees. And I called them, asked them a few questions, and then kind of crossed them off the list just because they didn't quite have the answers that I was personally looking for. So I think that's a good point, is we're interviewing them just as much as they're interviewing us. And I think that's an important point to make, is reach out. Don't be afraid to ask them questions, because it's your experience as much as it is theirs in their program. So I guess to kind of get to our last topic for the video, Zach, what's your kind of reflection so far? So you've been in the clinic for a couple weeks now, right? Kind of in the program. Yep. So you're kind of similar stage of where I'm at, just getting things are starting to really get heated up, starting to build a caseload. So what's kind of your take on it so far, your reflection so far? I know for me, it's been exciting and slightly terrifying and a little overwhelming, just, actually being a PT and seeing my own patients. And then for me, I'm in a brand new setting. So that's kind of throwing a little bit of a extra addition onto it that's making me a little bit more nervous, but I'm been super excited. I'm super happy with the mentoring that we've gotten so far and kind of how they've brought us through. And I'm excited to start getting into some more of the program, but I kind of want to hear what your reflection so far is. And then we're going to try and do this each month so that you can kind of follow our journey. Zach and I have kind of done this whole thing together. We went to high school together. We went to PT school together. We ended up living together for part of that. We took the boards on the same day. So we're going to try and bring you guys through our experience as we go through residency throughout the next year too. So Zach, if you want to kind of share your initial reflection, kind of just as you get started, or pre-residency reflection, and then we can kind of keep going with that throughout the next 12 months that are going to be exciting and a whirlwind of learning and growth. So.
Yeah. So, like you said, I'm in a very similar situation as you right now. Things are starting to get ramped up. I'm going to be starting my 4th week, but it was really like the end of the 2nd, 3rd is where things started to really pick up. And I was doing a couple evals per day. And I know Jonathan put out a video about signing that first note, which was both super exhilarating, but also super nerve-wracking at the same time, because you're like, I have the autonomy to do this now, but also my name is on this now, so like it's on me. So it was both like super exciting, but also a little nerve-wracking.
Yeah, definitely not gonna forget that.
Yeah, for sure. I'm totally gonna remember the first time I did that, and I can sign my name at the bottom of it. So yeah, things are starting to get crazy. And I think so far my biggest takeaway is to be a sponge, which I knew that coming into it. But every single day I go in there and I hear something or see something that I haven't seen before, whether it's from one of like the senior therapists or from an eval that I did, that they're like, well, have you ever thought of trying this, or maybe look into this thing next time? There's always something that you can learn from, be it also mistakes that you made, but also things that you did well during the exam. And I just had my last week, this past Thursday was my first mentor session, which basically included my mentor sitting in on 2 evals with me, reflecting before and after and that sort of thing. And the biggest thing that came out of that was just like organization, and having like a plan for what you're going into. And it was kind of cool to see that come out in real time, because the first eval was, if I just say it this way, a little bit all over the place. Got what I needed, but wasn't as structured as it should have been. And we discussed about that afterwards, and things that I missed, things that I did well. And then he's like, all right, now let's go kill this second one. Went into the second one, which was a foot and ankle, which is, to me personally, my the joint that's hardest for me.
Your Achilles heel per se.
Yes, exactly. And I walked out of that thinking that it went like pretty smooth for a tough diagnosis. And I told him that foot and ankle tends to be like a struggle for me. And he told me that it certainly didn't look like that at all. So I think it was, even just in like the first week, the first mentor session, it was awesome to see how what we discussed like immediately transitioned into the second eval. So then obviously it's just going to be about carrying that on and on throughout the next 12 months, but also, like I said, just soaking in everything that they have to offer. And where I am, it's a pretty big facility. There's probably 15 to 20 PTs. And the nice thing is that they are all like so willing to help. So the not hesitating to ask questions is huge, because it's such a learning and teaching environment, especially being like at Stanford, like it's a teaching hospital. So everyone is super willing to help. So I guess my biggest takeaways right now is, one, that they always say is, you're not perfect, and they don't expect you to be perfect. Just take what you get, learn with it, and then grow in the future. So I would say that's my biggest takeaway early on, because things have definitely been up and down already. But focusing on the ups and how to fix the downs, and then moving forward.
Yeah, that's great. And I can kind of relate to what you were saying with not feeling like things went as well as maybe they have. I know, especially because like I have little to no acute experience being in acute care. I feel like I don't know what I'm doing the entire time. And we'll get done with a session or whatever, and they'll be like, what do you think? And I'm like, I feel like I didn't do anything right. And they're like, you were fine. So It's kind of just like that. I was explaining this to my parents the other day. It's kind of like the constant like battle of, I can do this and you have no idea what you're doing, and like being confident enough to feel comfortable, but also humble enough to always be learning. And like you said, be a sponge. I think that's a great thought to have, and a great kind of just general attitude. Just be a sponge, learn from everybody and from everything, other disciplines, other PTs, other PTAs, anybody that you're around. Just try and learn something from them every day, and you'll keep growing. So, all right, Zach. So 3 words to describe how you feel the residency's gone so far, and then 2 things that you're looking forward to for the rest of October with your program.
All right. So 3 words that describe the residency thus far. That's a pretty big question. So I'm going to say,
I'll give you my three first. So my three are probably exciting, slightly terrifying. That's two words, but we'll say it's one. And then just unreal. Like I keep like forgetting like I'm actually like in like it's happening. It's here. It's now. I'm in the program. We're going through this like in real time. And I think that's just because it was something I was looking forward to for so long, and I put so much effort into going like to get here, and
Mm-hmm.
it's almost like hard to believe that I'm here. So those would kind of be my three, and the two things I'm looking forward to the most probably are we start our mentor sessions this upcoming week, so we get two of them a week, each with different clinicians, and then as we move on, we get extra clinicians throughout this setting. So I'm super excited for those, and then just being able to start building my caseload. So probably those two things, and really start getting into the nuts and bolts part of the clinic portion of the program. So those are my three words so far, and my two things coming up for the next couple weeks. So let's hear it.
So first one, I would say exhilarating, because the opportunities there, and then also just the feeling of having that autonomy. Intimidating because there is a lot to learn, and trying to focus on that I'm not going to get it all in a day. That's why I'm here for 13 months kind of thing. So don't expect to get it all right away. And a third, I guess I would say probably just, I mean, I would go with exciting as well, just because of all the opportunities that are there. And I know, like, looking at my schedule upcoming, that there's a lot of things to look forward to. And I could second that unreal, because it still doesn't feel real. So I would second that one too. As far as things I'm looking forward to, continuing to build my own caseload, and kind of starting to get more follow-ups and continue the journey with patients, because right now it's just like a ton of evals. So I'm excited over the next month to kind of see them more, and then start to see their improvement, and working towards their improvement. And then the continued lectures that we got a couple, usually 2 to 3 lectures a week, which the topics have been pretty awesome thus far, that make sitting in lectures not so bad. So I look forward to continuing with those as well.
All right, awesome. Yeah, my first ever eval, she discharged the other day. I went to go check in, and she was gone, and I was like, she made it out. But yeah, I think intimidating would be a better word than terrifying, because I feel like that's a better representation of kind of the emotions. Just intimidated by all of these people putting all this effort into the program to support me in my learning and my growth, and then just trying to soak it all in, like you were saying, and take it one day at a time, and realize that I'm gonna get there. It's gonna take me 12 months, but we're gonna get there. And so I think that's a good word, is intimidating. But is there anything, so it's kind of the questions I had for you. Is there anything you would like to say to any PT students out there, anybody considering residency, or any PTs that are out there and practicing that you would want them to know, or anything like that?
So let's, for students first, enjoy your time as a student, because the real life is coming, which by no means am I saying I don't enjoy this, because I love it and that's why I'm here. But enjoy your time in school, and use that time to help guide you where you want to go afterwards. And then I guess for practicing ones, or people that are considering residency, is just remember that there's always something new to learn. And that's something that's really I knew that, but it's really come to my attention since I've been here, is that if you're not learning something new every day in this field, then you're probably not doing something right, because there's always something. And be willing to accept that you don't know everything, which personally I'd say is really hard for me. is I like to have all the answers, but coming to the realization that you might not have all the answers is okay, and maybe sending like a patient referral to someone else or even another therapist that might be able to do a better job. There's nothing wrong with that, because ultimately the patient or the person in front of you is the most important thing. So I guess drop the ego and understand that not everyone is perfect and there's always room for improvement.
All right, thank you. So would it be okay if anybody that watches this video and wants to reach out to you with any questions regarding orthopedic residency or the program that you're in, would that be all right if they reached out to you and kind of to ask you questions, or maybe hop on a quick phone call whenever you have the time?
Yeah, of course. No, I love talking. Any questions, don't hesitate. We could I could give Jonathan either my email, phone call, or phone number, whichever you prefer, and we could go from there.
All right, so thank you for watching this video. Again, it's Dr. Zach Thomas in a residency out in California, and we will put some of his contact information down below. If you have any questions about anything he said today or anything I said today, feel free to contact either one of us. And thanks for sharing your experience so far, Zach, and hopefully we can keep this going and try and get some more reflections, maybe on a monthly basis, to keep just trying to educate people and give people some different perspectives and act as a resource for anybody that's willing to listen.
Yeah, sounds good. Thanks for having me on.
All right, we'll talk to you soon.
All right, see ya.
All right.